West Africa has been an international drug shipment hub. In 2016, the West African Regional Group, ECOWAS, launched an initiative to address drug trade and use through the criminal justice system as well as medical treatment. VOA senior analyst Jeffery spoke with ECOWAS and NGO anti-drug officials about this effort.
Because of its proximity to drug sources in South America and Asia and destinations in Europe, West Africa has long been a hub for trafficking illegal substances. Making it even more attractive to drug traffickers is the region's poor law enforcement and ability to monitor aircraft, boats, and container traffic. More reasons for West Africa's attractiveness to transnational drug trafficking are detailed via Skype from Geneva by NGO Global Commission on Drug Policy official Barbara Gudde.
Geography is a big part. Then, of course, it's a region that has seen a lot of civil wars until about a decade ago, and they're still struggling to recover from that. So governance in a lot of areas is weak, and drug traffickers know about that and move in where there's a void, where there's lack of governance on the ground.
Closely tied to weak governance is corruption, as amplified via Skype from Accra by NGO International Drug Policy Consortium official Maria Goretti Aneloglo.
You get instances where cartels are able to bribe officials with huge sums of money and to be able to get away with. So before you even get information that drugs are coming in, and so there should be steps taken to make sure that this is addressed. They have already passed because they've been able to.
To strongly address West Africa's drug smuggling and production, ECOWAS, the 15 member nations of the Economic Community of West African States, launched last November a new anti-drug action plan. High and middle-level drug offenders, the traffickers and dealers, are targeted under this plan for tough law enforcement and punishment. But for drug users, especially those who are addicted, the ECOWAS plan calls for alternatives to jail, medical treatment, rehabilitation, and social reintegration, as explained via Skype from Abuja by ECOWAS drug policy official Daniel Akwasi Amankwa.
Yes, we have it in our law books. But we need to also consider people who are using drugs as people who are having health problems. So it's a two-way approach.
The ECOWAS drug policy official says another sought reform is proportionate sentencing. Someone with, for instance, 50 grams of illegal drugs should not get the same jail time as someone else caught with 50 kilograms. Mr. Amankwa also says the group's drug action plan reflects the United Nations Office of Drug and Crime's position that the so-called war on drugs should be conducted by law enforcement to standards of fairness and respect for human rights.
When we talk about law enforcement at the outcome 2, we specifically added that the efforts or the approach towards law enforcement should be in consonance with the human rights stipulations in the member states' laws.
Mr. Amankwa tells VOA that ECOWAS is working to provide member states with templates for enacting uniform laws and enforcement regimens in order to prevent situations where drug traffickers use so-called easy countries to move contraband. He says ECOWAS is making a concerted effort to work with the European Union, which is the destination for the cocaine, opiates, and cannabis that floods through West Africa, to try to reduce the demand that in turn causes such turmoil among the ECOWAS states. Jeffery, VOA News.